Week 3, knee health. This week we're going to focus on the kinetic chain of your hip, knees, and ankles, creating stability and range of motion to allow them to move better and feel better. The first exercise, you'll lie on your back with your knees bent, feet hip width apart. You'll put a block between your knees. You can use a foam roller, a shoebox, a package of paper towels. You can use pillows too, as long as they're thick enough to create resistance, and you will squeeze and release 40 times. Try not to squeeze your stomach when you squeeze your knees. You're squeezing about 75 to 80% effort. Keep that stomach relaxed, just focus on the legs. Then we will replace that block with a strap around your knees, still lying on your back, feet hip width apart. Place that strap around your knees, and you're going to press out on that strap with the outside of your legs, working the muscles in the side of the hips and the side of the legs. You can use a belt, or you can even tie a robe belt as long as your knees are hip width apart when you press. We do not recommend plastic bands because they are usually too soft and don't provide enough resistance. You will do this 40 times. Then you will do femur rotations. You extend one leg out, keeping the foot flexed back, and try to keep the back of the knee, the bottom of the knee, down to the floor, and rotate your foot and knee in and out using your hip muscles. Try not to twist the hips. You'll do this 30 times on both sides. Then we will do foot circles and point flexes. We'll grab behind the knee of one leg, pull it towards your chest. You don't have to pull it up very far, but at least to 90 or a little bit further, and you will do circles 40 times one direction, 40 times the other way, and 30 times point and flex. Keep the other leg straight with the foot flexed, keeping your shoulders pulled down so as not to round the shoulders as you do the work with your ankles. Then you will switch sides and do the circles each direction and point and flex on that side. Remaining on your back, you'll bend your knees so your feet are hip width apart. This exercise is glute contractions. You will squeeze your butt cheeks together and release. The key to this is not squeezing as hard as you can and not squeezing your stomach. Again, you want to squeeze even 50 to 60%, trying to get the deeper glute muscles to squeeze. You will do this 40 times. You can place your hands on your stomach to make sure you're not squeezing your abs. You can place your hands on your glutes, feeling that squeeze and release, but the best position is to have your arms out while you do the squeezes. Then we will place that block back between your knees, just holding it, no need to squeeze it, and we will do rocking chairs with our feet, lifting your heels as high as you can and your toes as high as you can, rocking back and forth. If your feet walk away from you, you just pull them back and continuing rocking back and forth. We will do this 30 times. Isolated hip flexor lifts. On your back with your knees bent, feet hip width apart, you're going to lift one foot so the heel is up and the toes are on the floor, and you're going to move the other foot forward about a half a foot, and you will raise that foot up and down 4 to 5 inches off the floor, using the hip muscles to do the lifting. Try to keep the angle in the knee the same. Don't extend the foot back and forth, but use the hip muscles to lift the foot off the floor. You will do this 30 times on each side. Switch sides, move that foot forward, and lifting with the hip 4 or 5 inches. Then we'll move to the wall. You'll lie on your back with your legs straight up the wall, feet hip width apart, flexing your feet back. Keep your hips on the floor. If your legs are tight and you can't keep your hips on the floor because of that tightness, or you can't straighten your legs, scoot your hips back until you can get your legs straight and keep your hips on the floor. Hold this position for 1 minute. Flex the feet back. Keep the legs straight, pressing the back of the knees towards the wall. scoot forward as you can. Then we will separate your feet slightly, and we will do rotations from the knees, keeping the feet flexed back, creating the rotation from your hip, back and forth 30 times. We will sit in a chair on the front half of that chair, shoulders back, hips rolled forward, so you have a curve into your low back. Place that block between your knees, feet hip width apart and feet straight. You'll squeeze that block 40 times, squeeze, release, again using an effort of 75 to 80%. Don't squeeze as hard as you can, but enough to get those adductors to engage 40 times. Then we'll remove the block and put the strap around your knees, still sitting on the edge of the chair with your shoulders back, hips forward, feet straight, hip width apart, and you'll press out on that strap 40 times. You can use a strap, a belt, or even tie a robe belt around your knees to do the press outs. Elastic bands are usually too soft, so they don't create enough resistance. Next, we'll move to the staircase. Place your feet on the stair and allow your heels to drop down. Keep your heels, hips, and shoulders lined up, so you need to lean back slightly but not far enough that you fall. Hold on to the handrail, keeping your posture nice and straight as you hold this for 1 minute.